Mr. Natson. I'm Mia. I'm going to be your nurse practitioner today, and I'm going to do your exam today. Any questions? First, I'm going to check your skin. Just going to check your temperature, vigor, and texture. Everything looks great. We're going to move on to your head and scalp. I'm just going to check your scalp. Going to inspect your scalp and make sure there's no lesions or asymmetry or any trauma to your scalp. Okay. With that temperature, we're going to check your nails, okay? Your refill. Check for clubbing, which looks great. Okay. So your scalp looks great. And we're going to move on to your ears, okay? I'm just going to check your ears. The outside, we're going to palpate and inspect. Now pull up. Is there any pain? Okay. It goes up with no problem. Just going to look in gently, okay? Okay, we're going to move on to the other ear. I'm going to palpate your ear and inspect. When I lift up, do you have any pain? Okay. Looks good. I'm going to look in your ear, okay? Alright. That's good. Okay. I'm going to check your hearing. It's going to be 3 tests, okay? First, we're going to start. I'm going to use this device. I'm going to put it here. I'm going to check the hearing and make sure it's equal on both sides.
Stop.
Was it equal on both sides? Okay, we're going to check your mastoid process with this device as well. I'm going to palpate it before. Great. Ready? When it stops, let me know.
Stop.
Okay. Here. All right. And do the same thing over here.
It just stop.
All right.
It stop.
Okay. I'm going to do a test that's called the whisper test. I'm going to stand behind you. You're going to put your finger and hold in your ear. And I'm going to whisper 3 letters to you. I want you to repeat them back to me, okay? We're going to do it on both sides.
B A C.
I'm going to do the same thing on this side.
G B D.
Okay, that was excellent. Okay. I'm just going to palpate for T and J right here. Does it hurt here? Okay. You did your ear. Now we're going to move on to your eyes. First, I'm going to inspect and palpate your eyes. Going to start with your eyebrows. Into your eyelids. As I'm doing this, this is going to push against your sclera. Are you having any pain? Okay. I'm going to check your eyelashes. Now we're going to look in your eyes. I'm going to pull up. I'm going to pull down. Pull up here. Down. I'm going to check your lateral gland. actually check the functionality of your eyes. I want you to look straight ahead. Follow my finger. Okay. Light again. I'm going to check and make sure you're accommodating for the light. Look at the light straight ahead. Oh, looks great. Okay. We're going to do your temporal arteries. I'm going to listen. Okay, we're going to do the other side as well. Your occipital area. We're going to check for roots in your thyroid. Okay. I'm going to check your sinuses. We're going to start with your frontal. Your ethmoid. Any pain with the pressure? Xiphoid. Is everything okay? No pain? And your maxillary. Everything okay there? Okay, we're going to move on to your nose. I'm going to check your nose. Any pain or? Okay. I'm going to check in your nose. Okay, no drainage or? Okay. Thing looks good. We're going to check your lymph nodes, okay? We're going to start with your ocular, your preocular, your occipital, your tonsillar, your posterior cervical, anterior cervical, your posterior cervical, submandibular, mandibular, submental, subclavicle, looks good. Straighten your shoulders for me. Hold them up. Inferior clavicle. Everything looks good. All right, you can put your shoulders down. We're going to check your neck for your neck veins. Okay. Make sure your trachea is in line. It's in line. Great. Now we're going to check your mouth. Smile for me. Okay. That's good. Open up. Just going to to check for your color, your clarity, your moisture. It's pink and dry. Pink and moist. I apologize. Stick your tongue out. Any pain? All right, lift your tongue up. All right, let me see. All right. All right. So I'm gonna go back to your eyes. Okay. I'm gonna do your cover and uncover test. Okay, you ready? Straight ahead at me. Okay. Put this hand on this side. I want you to take your eyes both at the same time and move them towards this hand. I want you to do the same thing over here. Okay, Mr. Nancy, that concludes our